Hello, my name is Doneen Day. I'm the surgery coding educator for the Surgery Pod. And I want to speak to you today about the ICD10 updates that will become effective October 1st, 2016. Unspecified diagnosis. The Center for Medicare and Medicaid Services allowed a one-year grace period to adjust to the new coding structure regarding the uses of unspecified codes. However, that year is up and CMS will now expect physicians to document and code with the highest levels of specificity for conditions that fall within their specialty. Effective 10/1/2016, unspecified diagnosis codes will not be accepted for conditions that fall within the provider's area of expertise. Some documentation tips include: update the problem list to the most current specific diagnosis. Remove duplicate or conflicting diagnosis. Document according to acuity and the highest level of specificity. Document cause and effect relationships as well as linking complications to chronic conditions. Probable and suspected conditions should be reported as signs and symptoms until a definitive diagnosis is made. New codes include neoplasms. We used to just have genital urinary neoplasms of unspecified behavior. They've added the right kidney and left kidney, and of course we want to stay away from the unspecified kidney. New codes that have been added, these are brand new codes that we did not have before, include hydronephrosis with uretropelvic junction obstruction, coital incontinence, post-oral incontinence, post-procedure fossil navicularis urethral stricture, herniation of incontinent or continent stoma of the urinary tract, and then there's stenosis of the incontinent or continent stoma or urinary tract. That incontinent, those are two separate codes. And we have a lot of that where they've made codes specific to be incontinent or continent. So we'll talk about a couple more of those as we go on. Post-procedural complications. These codes used to say hematoma and hemorrhage of a genital urinary system, organ, or structure following a genital urinary system or procedure. They separated these out to be hematoma is a code, hemorrhage is a code, and they've also added seroma. So these codes are further broken down into whether the procedure was to a genital urinary system or an other procedure. So you can say whether it's a hematoma, hemorrhage, or seroma following a genital urinary procedure or other procedure, but it's always going to be of the genital urinary system, organ, or structure. Revised codes include, this is one of a popular code for urology: enlarged prostate with your lower urinary tract symptoms or without lower urinary tract symptoms. That language changes to benign prostatic hyperplasia, as it indicates a more specific enlargement of the prostate gland. And then there's also other post-procedural erectile dysfunction, and that's going to change to other and unspecified post-procedural erectile dysfunction. There's also some other codes for erectile dysfunction I'll go over shortly. But this terminology distinguishes the enlargement from other causes of prostatic enlargement, such as cancer of the prostate gland, acute and chronic inflammation and infection of the prostate gland, or prostatic abscess. Some additional new codes that didn't exist before are asystematic microscopic hematuria. Prior, we just had microscopic hematuria. Need to immediately revoid. We have position-dependent micturition. Prior, we just had other difficulties with micturition. So that code still exists, but now we have a position-dependent one also. There's chronic bladder pain, prediabetes, bacteriuria, rising PSA following treatment for a malignant neoplasm of the prostate. Prior, we just had an elevated PSA. We still have that, but also we can indicate that it's following a malignant neoplasm of the prostate. Abnormal findings on diagnostic imaging. Prior, we just had other urinary organs. They've broken that out to a code that includes renal, pelvis, ureter, or bladder, and then there's the right and left kidney. And again, we want to stay away from that unspecified kidney. One prosthetic code will be deleted and replaced by several codes with more detailed descriptors. Instead of dysplasia of the prostate, we have unspecified dysplasia of the prostate, which we want to stay away from, as they've given us codes for prostatic intraepithelial neoplasia, atypical small acinar proliferation of the prostate, other dysplasia of the prostate. Other is always better than unspecified, because other indicates that you may have some idea of the dysplasia of the prostate, why that condition exists, but we don't have a code for it. So that would be other, and that's always better than unspecified. Other new codes, these have been added to replace other specified disorders of the male genital organs. We still have that code, but it has an additional digit. And in addition to that, we have right testicular pain, left testicular pain unspecified. There's scrotal pain, and then here's the erectile dysfunction codes they added, following radiation therapy, following interstitial seed therapy, following prostate ablative therapy. Then there's some changes in codes for problems with the urinary tract stoma. These codes are say a lot about incontinent or continent. So it changes from post-procedural anterior urethral stricture to post-procedural anterior bulbous urethral stricture. We go from hemorrhage of the external stoma of the urinary tract to hemorrhage of the incontinent stoma of the urinary tract. And then we go from infection of the external stoma of the urinary tract to infection of the incontinent stoma of the urinary tract. Instead of malfunction of the external stoma of the urinary tract, we have malfunction of the incontinent stoma of the urinary tract. And then there's other complications of the external stoma, goes to other complications of the incontinent stoma of the urinary tract. And then we also have all of those codes with the continent stoma. There's complications of the genital urinary prosthetic devices, implants, and grafts. We have a lot of new codes for that. Breakdown, displacement, leakage, erosion, exposure, infection, and inflammatory reactions, other mechanical complications, and other specified complications. All of these require a 7th digit. A is for initial encounter, D is for subsequent encounter, and S is for sequela. So I'll go through some of these codes, keeping that in mind that these all require the 7th digit. Infection and inflammatory reaction due to cystostomy catheter, an indwelling catheter, due to a nephrostomy catheter, or a urinary catheter. And again, keep in mind these codes require that 7th digit. Implanted devices also have many reporting options. They include infection and inflammatory reactions due to an implanted urinary neurostimulation device, due to an implanted urinary sphincter, due to an indwelling ureteral stent, due to a urinary stent, due to other prosthetic device implant and graft, implanted penile prosthesis, due to implanted testicular prosthesis, and due to other prosthetic device implant and graft in the genital tract. So you can see they've really broken those codes out for us to be more specific. These codes are revised. There's a breakdown, displacement, leakage, or other mechanical complication for the indwelling urethral catheter, nephrostomy catheter, urinary tracts, and implanted testicular prosthesis. And again, we want to keep in mind that that 7th digit will be for the initial encounter, subsequent encounter, or sequela. And then we have erosion and exposure, and that's the graft of the urinary organ, urethral mesh or bulking agent surrounding the organ or tissue, and prosthetic materials, all requiring that 7th digit. That's all I have. Please feel free to contact me with any questions or concerns you have about these codes. I'm always available. Thank you for your time.